variety of medications that are used basically to manage osteoporosis. The one that you can look at online is a drug called Forteo, because I think that's the one
That's
that
exactly what I was going to ask you about.
that's the one that Dr. Mominini would be most interested in here. It is the only agent that we have that actually builds new bone, promotes bone formation, and with hardware in the neck, the hope would be that that new bone formation would help to sort of seal around the hardware and hold it in place so that you don't get any slippage and you end up with a better surgical result. So it basically needs to be given as a subcutaneous injection. It's given in a pen, sort of looks like this. Put it against the skin, you dial up the dose, you press the button, dose is over. But you need to do that every day. The drug basically is associated with an increase in bone density of about 5 to 10% over 1 year, but it reduces your risk of fracture by about 60%. So pretty good drug, you know, for reducing fracture risk. It has some potential side effects, which you'll see online when you look. It can raise blood calcium levels, so we need to follow closely to make sure that your calcium is remaining in range. It can cause some aches and pains in bones and joints sometimes. Usually they're manageable, you know, with some Tylenol or something like that. So it's not excruciating pain, but it can be sort of bone discomfort. Many people have likened it to the growing pains maybe that they experienced as an adolescent.
Didn't shriek in pain.
The other thing, which you'll see a lot of writing about, is a black box warning that's on the drug. Black box warnings are typically sort of potentially high danger areas that are put there by the Food and Drug Administration. And where this black box warning came from originated back in the 1990s when they were using this drug to treat osteoporosis in a rodent model in the laboratory. And these rodents basically had a predisposition in their genetic makeup to develop osteogenic sarcomas, which are malignant tumors of bone. They occur primarily right in the bone, and they metastasize out of bone. So when they gave the Forteo to these animals over the course of about 2 years, which is the entire lifetime of the rat, there was a significant increase in the incidence of these osteogenic sarcomas. So when the FDA saw that, they said, well, we'll approve the clinical trials to use this, but it's got to be held to 18 months because in a rat, 2 years saw more bone cancers. And they had to screen very effectively for the presence of bone cancer. So the clinical trials were done back in the late 1990s, early 2000s. The drug subsequently was approved in about 15 years ago now. But the stipulation both for the trials and then for the subsequent use of the drug is that it's limited to 2 years. So you take it for 2 years and then you have to shift off to some other kind of therapy to try to hold on to whatever gains you get with the Forteo. The long and short of it is that we've had 15 years on the market and a lot of post-marketing surveillance with people reporting side effects and the like. There does not appear to be an increased risk of osteogenic sarcoma in humans. The risk is about equal to what the background risk would be in a population not treated with the Forteo. So it seems that that particular problem was a problem that was limited to that specific strain or species of rat. Yeah. The drug works pretty well, and as I mentioned, it has been effective in small series in helping to cement hardware in place that's been placed there by neurosurgeons or orthopedics. But there's a limited amount of data about that, and predominantly collected by a group in Japan. I need to tell you that this is fundamentally what's described as an off-label use of the medication. It's there for treatment of